very good afternoon, everyone. My name is Ruchira, and on behalf of the National Institute of Rural Development and Panchayati Raj, I extend a warm welcome to all the dignitaries present here. And this is our first webinar of the Evidence-Based Policy and Action Roundtable. So welcome. We are enthused to have Dr. Sabina Alkire with us today. She is the Director of Oxford Poverty and Human Development Initiative in the UK. We also extend our welcome to our Honorable Chair of the webinar and Director General of NIRT PR, Dr. G. Narendra Kumar, all the invited experts for the consultation, our esteemed audience, including my colleagues, scholars, and our beloved students. Today's talk on policy lessons from multidimensional poverty analysis in India is the first and inaugural webinar of our project, which is the Evidence-Based Policy and Action Roundtable, Consultations and Dialogues for Holistic Rural Development. This project intends to facilitate cross-learning of sharing of evidence to help plan actionable interventions and develop strong monitoring framework. Starting today, we shall meet regularly to discuss on various working areas connected to rural development with the hope that these dialogues will take us towards a strong rural development policy. Our webinar series starts with a fundamental and a highly debated and contested area of rural development, which is poverty and poverty reduction. In India, we have seen various debates on poverty issues in terms of its definition, measurement, trends on the nature, coverage, and type of action against it. As we are witnessing a re-emergence and deepening of different forms of underdevelopment and unfreedoms in this unprecedented humanitarian crisis ensued by the outbreak of pandemic COVID-19, there is no debate on the interrelated and multifaceted nature of the unfreedoms and misfortunes. Our webinar today will present some latest evidence and trends of poverty as a multidimensional construct. Now, before I introduce Dr. Sabina Alkire to all of you, I would like to invite our Honorable Director General, Dr. G. Narendra Kumar, to deliver a welcome address. Sir, over to you.
Thank you, Ruchira. I hope I'm audible. Very good afternoon to everyone, and a warm welcome to Dr. Sabina and our faculty members from NIRD, from the various state institutes of rural development, other professional colleagues and participants in this webinar. It's indeed a great pleasure and a momentous occasion for us to have Dr. Sabina deliver a lecture on this occasion. And this is one of the new initiatives being taken up by the National Institute of Rural Development's Delhi branch. So this is one of the first ones that we're taking up. Therefore, befitting to have an eminent speaker like Dr. Sabina speak on this occasion. So I thought I'll share some of my thoughts on the multidimensional poverty before the expert Dr. Sabina comes up with and our experiences in India and what our expectations can be from the global multidimensional poverty index that's there and its adaptation to India. And in this, I draw upon my experience working in the field and as a policy maker, the state governments and at the national level. India has been harping on the concept of Antyodaya from 1977 onwards, that is reaching the lowest rung of the poverty-stricken population. And even though this has been espoused, there have been few ways in which we could reach the lowest rungs of the poverty, because in the poverty alleviation programs designed, we couldn't really reach the really lowest rungs of the poverty. And therefore, the programs have been rolled out more or less generally. And in that direction, it will be very useful for us to have an effective targeting of our programs to understand the different deprivations to arrive at the Antyodaya, the really deprived, the lowest rungs of the poverty stricken, so that our initiatives can be well targeted. And from 1977, when the poverty counting really started in India, until 2017, about 40 years, we emphasized on consumption-based single factor index. And that was based on a poverty level basket. So on that, we really based all our programs. We had a door-to-door survey of the poverty stricken and below poverty line families, and on to them, the benefits were really reaching. In 2011 or so, the government of India came up with a socio-economic caste census. More or less around the time, that the multidimensional poverty index was being developed, the Indian government came up with the socio-economic caste census, and that had elements of exclusions and inclusions. There are about 13 criteria of excluding families from getting benefits as poverty-stricken families. So in that process, about 7.07 crores of households were excluded following the 13 factor criteria. And about a 0.6 crore households were included following some five factors. And about 8.72 crore households eligibility to get benefits under the poverty alleviation programs and various other social welfare programs was based on multi-dimensional poverty indices. So towards that end, Government of India developed about 7 criteria, which I read, and they go as follows. Households with one room and no solid walls or roof, households with no adult in the age of 15 to 59, female-headed households, and households with differently abled, households with no able-bodied male, scheduled caste, scheduled tribe households with no literate member above 15 years, landless laborers who were to rely on manual labor. These were the 7 deprivation criteria based on which the 8.72 crore households eligibility was to be determined for getting benefits under the poverty alleviation programs. The first thing I think I thought I will place before this August forum is the uh, matching between the criteria laid down by the SCCC and the multidimensional poverty indices. As far as India is concerned, we already are traversing and traveling on a path laid down by the SCCC. So how do we bring about a correlation between the global multidimensional poverty index and the SCCC system that the government of India is already following? That is one key element that we would like to think about, especially the focus in the multidimensional poverty indices on child mortality and nutrition. So which I think Sabina will speak about in greater detail. But again, the adaptations of this in India, we've been tracking as health indicators for quite some time, factors such as infant mortality rate, maternal mortality rate, and immunization rate. These are our 3 main criteria for knowing that the public health system is doing well, be it in rural areas or in urban areas. So I think we could do well by plugging into these established criteria, which will be easy to track because there is a well laid out mechanism to follow on these indicators. Next dimension which is used in the multidimensional poverty is on education, years of schooling, and the school attendance, so on. Here again, the Indian system has well laid out and well tracked indices, which are the gross enrollment ratio and the dropout rate. So again, it will be useful to plug into these indicators. So the rollout of a multidimensional poverty index will be much easier. Of course, the SCCC has laid little emphasis on the standard of living, except to use some of the 13 criteria, exclusion criteria, to exclude people from the from getting poverty benefits if they had certain certain of these standards of living available to the households. So this is a new area of engagement in India. How do we utilize the standard of living indicators to arrive at the poor? So that is an evolving area of work, and we would look to making contributions in that direction from the National Institute of Development. So one other thing which I thought is seems to be missing in the multidimensional poverty indicators, of course, Sabina will elaborate on that and clarify to us, would be that look, the key factors which we perceive in India are drivers for poverty, for pushing people into poverty, households into poverty, are 2 main things. One are disasters which strike families. When there is a drought or a flood, a family goes into poverty. And once they slip into poverty, it takes generations for them to come out of that poverty. Not only because of the non-availability of physical facilities, financial resources, but also because of mindset. People start believing that, look, this is their fate, and they refuse to fight the poverty, refuse to come out of it. Even if resources are available, opportunities are available, it becomes a psychological problem. So disaster driven push into poverty is something that we would like to see that it is factored in. And another very important factor which has been contributing to poverty in India, very widely known, is the healthcare expenditure, non-availability of healthcare facilities in rural areas. That is a very important factor which pushes people and families into poverty, especially when there is a loss of a sole breadwinner, either because of accidents, because of falls, or because of ill health. So because of these reasons and the consequential health expenditure, the families go into uh, abject poverty, and it takes several generations for them to really step out of that poverty. So when we're trying to construct an multidimensional poverty index, we need to take these important causative factors also into consideration in constructing the index. Even if there are no direct indicators, we need some surrogate indicators, which perhaps if they are introduced and incorporated in the multidimensional poverty index, they would be useful. Another important thing that I thought I'll share with all those who present here is that the Indian government's conception, as would perhaps be the thinking of any national government, would be to say that the poverty indices are really a guide for us to see how we're progressing on the poverty front, how much progress we are making. Of course, there are studies to say that India has done quite well. There's some which say that, look, we have lagged behind China, and so on and so forth. But we don't have to re-emphasize to say that we need to use the indices to track the progress on the poverty front. But I would like to look beyond this to say that it's not enough to track the progress at a macro level or at a regional level, but also to have indicators which would be more intervention oriented. That India could make reasonably good progress without really having strong multidimensional poverty indices because of the various interventions, reasonably well-planned interventions, which bore fruit. So the indices which are developed should be closer to the interventions, draw upon the interventions, and point to how well the interventions are working. So that is again something that we will look forward to in the multidimensional poverty indices. And I'm very glad to know that the Niti Aayog is working with the Oxford Poverty and Human Development Institute to bring about this coordination. They have a coordination committee on multi-dimensional poverty indicators, and sure they will consider these factors, and we will be also be very glad to contribute to the Niti Aayog because we are also a Government of India funded and Government of India led institute, and we would be happy to to collaborate with the Niti Aayog in taking this forward. Also, I would like to share with the august audience present here about some of our thoughts on a new center that we would like to set up in the National Institute of Rural Development. We have about 20 centers in the National Institute of Rural Development, which focus on various areas of rural development. But one thing which we were perceiving is perhaps missing is a center on integrated village development, because the rural development in India typically takes place in silos. It's considered in silos. Interventions are considered in silos. There are educational interventions. There are health interventions. There are income boosting rural development initiatives. there are infrastructure initiatives and so on and so forth. But there doesn't appear to be a common binding framework across all these initiatives, which focuses on improving the quality of life of the rural citizens. So how can we develop such a model of integrated village development, which has the household as the center? And perhaps utilizing the multidimensional poverty index, for which the household is also the basis, would be useful to move us forward in the integrated village development concept and in running our integrated village development center, which we are in the process of setting up. So as a part of that, we'd also like to consider the poverty dynamics, how families slip into poverty, how households come out of poverty, what interventions are really necessary and crucial to bring people out of poverty. Is it only income? Is it education, health, infrastructure? What are the various conglomeration of events that really help people step out of poverty? So these are the things we would like to this center to consider, and we look forward to collaboration from the Oxford Poverty and Human Development Institute and from others who are present here in setting up this center in the National Institute of Rural Development and to run it ably. So with these few words, I'd like to stop here and we'll invite the guest speaker of the day to deliver the lecture. Thank you very much.
Thank you, sir. Thank you for setting the agenda and thank you for bringing it to context, the discussion that's going to happen today. Dr. Sabina, we would like to invite you to share with us your analysis. Before that, let me introduce you to those present here. Our honorable speaker, Dr. Sabina Alkire, is the director of Oxford Poverty and Human Development Initiative at the University of Oxford in the UK. With a background of multiple disciplines such as economics, sociology, and ethics, Sabina has worked extensively on welfare economics and measurements of freedoms and human development. Influenced by the capability approach early in her career, Sabina has specialized in understanding poverty as a multidimensional construct. With James Foster, she devised a new method for measuring multidimensional poverty, which complements the monetary poverty measures. This metric of well-being is flexible and often include dimensions such as health, education, nutrition, standard of living, work, security, lived environment, and other valuable aspects of life. The MPI has been adopted by governments across the world, with its most visible application as the Global Multidimensional Poverty Index that OPHI and UNDP's Human Development Report Office updates annually. Sabina's academic career has been decorated by many recognitions and awards. She received the UK's Economic and Social Research Council Celebrating Impact Award and the Royal Government of Bhutan Award, and her organization OPHI received Queen's Anniversary Prize, among many others. Sabina participates in initiatives seeking to take rigorous, efficient, multidimensional approach to poverty or well-being. For example, the Commission on the Measurement of Economic Performance and Social Progress for the Government of France, Commission on Monitoring Global Poverty by the World Bank, among others. She will share with us findings from her study on MPI in India. I know I have told you to be non-technical and to understand that you have a very mixed audience, but since Sir also brought about bringing in new indicators, so maybe you could somewhere in your talk, you can also reflect upon the sensitivity part of your index and kind of give your insights on that. So over to you and welcome, Sabina.
Thank you so much. And it is very much an honor for me to be here and very interesting to hear all of the work that is proceeding, all of the aspirations and plans that are underway. It would be a delight for us to be part of an initiative on integrated rural development and to really learn from many of you. I think that this is hopefully the beginning of an interesting phase of real interactions and learning from many of the more local actors, the rural actors, into what has worked in the past and will work going forward in terms of ending poverty in all its forms. So we will talk today about multidimensional poverty, and that's a very long word, but intuitively we know what it means. It means that people's carry many different deprivations at the same time. They wake up and maybe the roof is dripping because there's a leak. Maybe they don't know if they will have work that day. maybe a child is not going to school. Maybe there could be concerns about food security. Maybe there's no electricity to boil the kettle. So these are the different deprivations. And what's different about an MPI is that you are asking which of them strike the person at the same time. What is their deprivation load? And how is that changing? So I will focus on measurement, but the aim is to illuminate the lived experience of poverty in order to reduce it. So the words of Tshering Tobgay, former Prime Minister of Bhutan, are apt. Measures are like eyes. They help us to see things. They bring matters into focus. And so in his country of Bhutan, the national MPI is not just a measure, but a policy tool. So I will first introduce the Global Multidimensional Poverty Index and show India within the context internationally, and then go into the results for India, the level and the change of poverty over a decade. And then I will ask, what does this have to do for policy? And I will show you how some other governments have been using their MPIs, their national tools, to shape different kinds of policies, whether budgeting or targeting like the BPL, or a coordination of policies across levels and sectors of government. So first of all, as we all know, and as the director of NIRD mentioned, we live in an era of sustainable development goals. And what is different about these goals is that they recognize that poverty has many forms and dimensions. So the first of 17 goals is to end poverty in all its forms. That alone recognizes that poverty is multi, and that the monetary poverty is one important component of poverty, but not the only one. There are 169 targets. The first target is to end $1.90 a day monetary poverty, but the second target is to reduce the MPI. And there are 232 some indicators. The first is $1.90 a day. The second is national monetary poverty measures. And the third is the MPI. And this is reported in the global SDG database. And what is important about the MPI is that the SDG document recognizes that poverty is the greatest global challenge. But there are other things. It calls to leave no one behind, to present disaggregated results. We cannot disaggregate $1.90 a day poverty by state or district of India, but we can disaggregate the global MPI. The third is that the SDGs recognize the importance of integrated multi-sectoral policies. And the MPI in many countries is the evidence required to shape those policies. And so I will go through and present these measures, but also make some links to the international scenes. So any multidimensional poverty index begins by identifying indicators that are available for all people or for all households. So the global MPI has 3 dimensions: health, education, and living standard, and 10 indicators. You are deprived if nobody in your household is undernourished, if anybody in your household is undernourished, and you're deprived if a child has died in the last 5 years. You're deprived if no household member has completed 6 years of schooling, or if a child aged 10 and above is not attending school up through class 8. You're deprived if you cook with wood, dung, or charcoal, You're deprived if you don't have adequate sanitation, a protected pit latrine, a compost or flush toilet, or if you share it. You're deprived if you don't have safe drinking water from a protected spring or well, or piped onto the premises. Or if you have to walk a half an hour to obtain water, then you don't have adequate water. You're deprived if you lack access to electricity, and if your roof, wall, or floor are natural or rudimentary materials. And you're deprived if you don't own more than one of 8 small assets: radio, television, telephone, animal cart, refrigerator, computer, bicycle, and motorcycle. And if you own a car or a truck, you're not deprived in assets. So those are 10 indicators. And for each person within a household, we can create their profile of deprivations. So Kari, in this example, is deprived in nutrition. Some household member is undernourished. Deprived in years of schooling. Nobody in her household has completed 6 years of schooling. And they are deprived in all 6 of the living standard indicators. So then we create a deprivation score for Kari. And in this case, the 3 dimensions are equally weighted. So you can see visually that the indicator weights on living standards are lower. But they are deprived in all living standard indicators, which is 1/3, and in 2 health or education indicators. So she's deprived in 2/3 of the indicators. That's her deprivation score. For the global MPI, anybody who is deprived in 1/3 of the indicators or more is poor. So Kari is poor. So from that, we can identify who is poor. And then the MPI is the poverty rate or percentage of people whose deprivation score is 1/3 or more. We call that the incidence, multiplied by the average deprivation score among poor people. Kari's is 2/3, but on average, it might be 45%. Multiplying these 2 numbers together, which your children can do, it's easy if you are a student, is how you obtain the MPI. So I'm going to share some of the results. Every time I mention India, it's 2015-16 data, so it's a little bit old, but it's the most recent survey data that we have. So first, in 2020, we used data sets in South Asia, which other than Bhutan were from 2015-16 up to 2019. And last year, 2020, we covered 107 countries and 5.9 billion people. And across all of those countries, 22% of people were multidimensionally poor. And 5 out of 6 of them lived in South Asia and Sub-Saharan Africa. We also have trends over time that I will show you. I think you may already know of them. And we have a COVID analysis that shows us that sadly, COVID probably set countries' trends back by 3 to 10 years. Within South Asia, of those 1.3 billion, 530 live in South Asia. And I don't want to drown you in numbers, but it can be interesting to see how your neighbors are doing. Bangladesh has more recent data at 2019, but it has, by 2019, it had a lower headcount ratio and MPI than India, which had 28%, 27.9% in 2015-16. The highest poverty in South Asia is in Afghanistan at 56%, and the lowest is Maldives at 1%. One of the features of the MPI that drives policy, that we'll come back and study in depth, is the fact that you can know how people are poor according to each of those 10 indicators. We see here that India Sri Lanka and Nepal have a similar indicator composition of poverty. The stripy colors are similar, although their levels of poverty are quite different. And that, I'll show you at the end, is what countries are using for policy. This information is very important. So when you are at the local level, at the Panchayat level, at the district level, this is the data which is really useful in terms of knowing where to put your force so that poverty comes down fast. And as I mentioned, we disaggregate not only India, which I will show you, but most of the countries of the world. And so we have over 1,200 subnational regions. And for all of them, we know their composition as well as their levels of poverty. So in 2020, we also looked at how 75 countries had reduced poverty in the most recent period. Those 75 countries are home to 5 billion people. 65 of those countries had reduced MPI significantly. The fastest to do so were countries in Africa, including Sierra Leone during its Ebola crisis, a fantastic success. But in terms of the number of people leaving poverty, India led the world. Over 270 million people exited poverty in a decade, 2005-06 to 2015-16, and we will study that more. South Asia, driven by India, had the largest reduction of MPI of all of the world regions. And India was on track at that phase by 3 different models to cut its MPI by half going forward from 2015 to 2030. Of course, this was before the pandemic. So India didn't have the very fastest reduction. Some very smaller, much smaller countries did. But because of the numbers of people involved, it is a world leader. So let's look into this story, even if it's not precise and even if it's a little bit out of date. It shows the kind of analysis that MPI can do. And the next time that India updates its National Family and Health Survey, NFHS survey, we will be able to track changes at the district level. And that will be, of course, very interesting to NIRD. And also, we can go within districts in some cases to look at rural versus urban areas. So the data sources I'm using are the NFHS 3 and 4. These results are published in a paper in World Development this year. So the key finding, which struck us when we looked at the data, is that the multidimensional poverty index was cut by half in 10 years, from 0.283 to 0.123. Now, what does the MPI mean? The MPI shows that poor people in India experienced 28% of the possible deprivations if everybody in India was deprived in everything. And that had come down to 12.3% by 2015-16. In terms of being identified as poor, 55% of people in India were identified as poor in 2005-06, almost the level of poverty in Afghanistan. And that had come to 27.9% by 2015-16. So 2.7% of the population of India left poverty every year for 10 years. But also the average deprivation score of the poor, remember Kari's deprivation score was 2/3. The average had come down from more than half, 51.3%, to 44%. Again, a very strong reduction. So let's put that in context. We all know that it is China's reduction of monetary poverty that meant that the world as a whole attained the Millennium Development Goal 1 on ending monetary poverty by half. And it did so by reducing monetary poverty greatly. So let's look at some different numbers. From 1990 to 2000, 196 million people came out of poverty in India, in China. But from 1995 to 2005, according to the government of China, 268 million people came out of poverty. According to the World Bank, they found that in 12 years, 267 million people came out of $1.25 a day poverty. But we are seeing that in that same period of 10 years, 271 million people came out of poverty in India. So that's a change that shakes the world. It's a change that many countries want to learn from and that we want to understand. We don't understand it fully, but we do know how poverty changed. And that's what we're going to focus on for the next 10 minutes or so. The key finding is that the poverty reduced and that it was pro-poorest, as we will see. And I won't go into details, but all the findings that I present are not affected if we slightly change the weights or the poverty cutoff. So for example, we did 20 trial MPIs with different indicators, different definitions of child mortality. We used different nutrition indicators, different housing indicators. And according to all of them, at least 270 million or more came out of poverty. Only if we dropped adult malnutrition did that number come down. So it's a very robust result. And it's also much higher, although usually countries update their MPI far more often than every 10 years. And I would echo the comment in the beginning, in the opening, that hopes that India will update the data for the global MPI more often going forward. But in that 10-year period, 271 million people left poverty in India, more than in any other country that we studied. The next most people were in China, where 70 million people left poverty in 4 years. And then Bangladesh, where 19 million left 5 years. Of course, these are smaller countries or they have lower levels of poverty. So they couldn't get 270 million people out of poverty. But it's still important to see the magnitude of this change and to think of how to continue it going forward, because there were still 377 million people in poverty in India in 2015-16. So one of the positive findings is what that means is that you don't want the poorest groups in a country to have slower progress than the least poor country. On this graphic, the poorest states of India are on the right-hand side: Bihar, Jharkhand, Madhya Pradesh, Uttar Pradesh, Chhattisgarh. They were the poorest in 2005-06. It's a race towards zero poverty, and the states with the lowest location are running the fastest. They're reducing poverty the fastest. So if you think of it, they're catching up, right? They're the poorest, but they're moving the fastest. And Delhi or Kerala are naturally moving slower. Does that mean that Delhi and Kerala are not doing well? Not at all. In relative terms, Kerala did fantastic, as we will see. But it didn't have that much poverty to begin with, so it couldn't move as fast as Bihar or Jharkhand. Why was I so struck? You know, you're sitting behind your computer analyzing poverty. Those of you who are students or professors will know what I mean. And you get the results. And then your heart starts going very fast. And the reason is that previously with Dr. Shuman Shet, we had also looked at the trends of multidimensional poverty in India from 1999 to 2005-06. And in that 7-year period, the pace and the pattern of poverty were different. Our study, also published in World Development, was later republished by the World Bank's Global Monitoring Report. And what we found that time is that rather than the poorest states on the right-hand side making the fastest progress, they made the slowest progress. In fact, Bihar had 0 statistically significant changes in MPI. And if we went back over time and looked at the trends, we see that the pace of reduction from 1998-99 to 2005-06 was gentle downhill. But then it became a steep downhill till 2015-16. So there was a slow reduction of poverty for 7 years, and then a much faster reduction the next 10 years. In fact, 8 times more people left poverty per year in the second period than in the first period. So that's why I think it is important to understand what went right in India in that period, not only for yourselves going forward, to focus on the lives of the 377 million people who remain poor in India, but also so that other countries can learn from you. And I will mention at the end that there's a South-South network that India participates in with 60 countries, and all of them are seeking to reduce MPI. So you would have friends who would want to learn from what has gone well. Now, did that change of the poorest groups reducing poverty the fastest happen for other groups? For example, the children were the poorest, but they had the fastest reduction of poverty, faster than adults. The scheduled tribe and scheduled caste were the poorest, but they had the fastest reduction. Across religious groups, the Muslim and then the Hindu were the poorest, and they had the fastest reduction in that order. So we talk about equalizing changes, and this is an equalizing change. The poorest are being improved. But as I said, it's not over yet. So before we get too happy, I should mention that in 2015-16, still over 1 in 3 children aged 10 to 17, 35% of children are poor, whereas it's just under 1 in 4 adults, 24%. So of the 377 million, 2 in 5 are children, 42%. So going forward, there's a need to continue to invest in children's nutrition and school attendance, but also in the deprivations that afflict children across the different indicators. As we are focusing on rural development, you will know this, but 89% of the poor in India, according to this measure, live in rural areas. So your work here is so important. In rural areas, 37%, so well over 1 in 3, are poor. And in urban areas, it's 9%. So there are 337 million poor people in rural areas in 2015-16. And also across states, 4 states, Bihar and Jharkhand, Madhya Pradesh and Uttar Pradesh, are home to over half of the poor people in India. So there's still a focus needed in those states that had some of the very fast changes. So it's not just learning what went right and sitting back and relaxing, but it's continuing the momentum, continuing to advocate, to work so that this change is continued. But what can we learn from the MPI about what went right? About what policies may have proven successful? So this graph shows all of the 10 indicators, and it shows the percentage of the population who came out of being poor and deprived in each indicator. So we see, for example, in nutrition, about 22% of the population of India were poor and deprived in nutrition in 2005-06, but not in 2015-16. That's 1/5 of the population. And it was over 25% who were poor and deprived in cooking fuel or sanitation or assets, and were not by 2015-16. But each of the 10 indicators had a statistically significant reduction. And the finding of electricity is particularly important because electricity we think of as such a basic aspect of human life. 10% of the population of India were poor and deprived in electricity in 2005-06, but not in 2015-16. Sorry, I've got that wrong way around. It's 20% for electricity. But the other thing is that this varies by states. So let's just look at Bihar and Chhattisgarh. Both of them had fantastic reductions of poverty, but how they did it varied. Bihar had a much bigger improvement in out-of-school children, as well as in electricity and assets. More than 1/3 of people in Bihar had been poor and deprived in electricity in 2005-06, but were not by 15-16. And in Chhattisgarh, there was more reduction of nutrition and of cooking fuel and sanitation. So learning from went right among the poor and also across the population, which I don't have time to share, is important. It's also important to know what the biggest deprivations were. Because, for example, child mortality has a little reduction, but that's because relatively few people are deprived in child mortality, even in 2005-06. All of this information is on the data tables, and sometimes local universities provide a one-day course in how to interpret those data tables for each area. Not even a day, a half day is enough. But you can also think of different policies in each state or when we have it in each district, and we can see precisely what changed. We have this, of course, at the state level for every state in that 10-year period. And we will also, of course, have it at the district level next time. I also wanted to mention on this slide that some of the low poverty states, like Kerala, Goa, Punjab, Himachal Pradesh, Tamil Nadu, Haryana, Karnataka, and Sikkim, and Andhra Pradesh, they had the fastest reduction relative to their starting level. So they're not as poor as Bihar or Jharkhand, but in terms of cutting poverty, the proportion of poverty they cut, it's very fast. So it's useful to look at both of those numbers, the relative and the absolute reductions. I won't get into it here, but that's available on the website. So that's a little bit about the trends in that 10-year period. Those trends are robust, as I said, to different indicators. To any poverty cutoff, there was a strong reduction with almost the same numbers of people coming out of poverty across a wide range of poverty cutoffs. And the other good news going forward, thinking about your work, is that in 2015-16, 60% of poor people had a deprivation score that was less than 40%. It was between 33 and 40. So remember that Kari was deprived in 2/3. But now 60% of the poor in India only had to reduce 1 or 2 deprivations to come out of poverty. That's much easier than it was in 2005-06. So my hope is that despite COVID, there can continue to be a fast reduction going forward. So we can see how the indicator changes drove progress, but the next step in each state is to link those to public expenditures, to schemes, to different actions, governance institutions, but also the disasters that were mentioned in the introduction. And we recognize that the data set that we have leaves out a lot of indicators, but the global MPI was developed to be comparable across the 100 countries. So we needed indicators that were present in all of their data sets. But for bespoke studies, we can use some additional indicators. We also have a paper on whether or not this change was driven by growth, but there's no direct relationship. So the paper is now published with Schumann-Schett, but many agree that what really drove the changes in India was not the growth itself, but how it was used by investing in the different schemes, whether it's, I don't know what they will be in each state, but whether midday cooked meals, whether the Anganwadi system, whether sanitation programs, etc. So what I want to do now is think about the future. So I'm going to sort of go beyond India and show how other countries are using the data from the MPI in terms of their own policies. And they are using it at the national and at the subnational level. For example, the state of Oaxaca in Mexico has a very, very committed governor, and his team have reduced poverty very strongly in Oaxaca. And they've written about it, they've shared it in our South-South network with heads of state. So we are learning from many people at different levels of government. So I mentioned that the Sustainable Development Goals include an MPI. Many governments have chosen to create an MPI that's tailored to their own needs instead of using the global MPI. But some other countries, including Nepal and South Africa, have used the MPI, the global MPI, as being appropriate for their contexts. These are permanent metrics that they update regularly and that they submit to the global SDG database. But most importantly, they use these measures. So I'd like to show you, with permission from the governments whose slides I use, how they use them. And I mentioned the 60 governments, or 60 countries who participate in the network and the international agencies, and they are here. So first, it's simply to complement monetary statistics. So most countries, when they release their MPIs now, the newspapers carry it very important, as a fact. In Philippines, in Chile, in whatever it is, South Africa, the government now has two poverty measures, a monetary one and a multidimensional one. And they're like two eyes. They see poverty from different angles, and so they give it a better understanding. The second is to see how poverty has changed over time. Colombia, for example, from 2010 to 2018, reduced poverty by 1/3. Every country uses the MPI trends and discusses them, as we've just been doing using the global MPI for India. But here, then, they go beyond that. So one very fundamental use is budget. It costs money to reduce these deprivations. So for example, this is from Costa Rica. When they launched their MPI, they analyzed each of their indicators, and that's the percent of the carencia, and they analyzed their budget allocation on the right-hand side. And they found that there were some indicators which had zero budget allocation, no programs to move them. Things like if children were not in the right level of schooling, or if they weren't attending higher levels of secondary school. So the then president, Solis, was worried. They were in a time of a fiscal crisis. So he issued a presidential decree that the budget had to reflect the level of MPI alongside some other indicators. Without increasing the budget, they reallocated it. And the next year, they update their MPI every year, they showed an acceleration of poverty reduction. It went down faster. The man who was then the minister for social development, Carlos Alvarado, is now president of Costa Rica. So working on MPI can be good for your career. And they've continued to have a clear budgetary link. But most of the governments in Latin America that use the MPI have this. Another very common use is to target regions of the country or households for different beneficiaries, for different kinds of benefits. So in terms of the BPL, whether it's Bhutan, whether it's Chile, whether it's in some senses China, the identification at the household level of the last mile is done. And then people are reached and they become beneficiaries of programs that are tailored to their particular deprivations. But there are also group-based targeting. In Panama, where 8.5% of people in Panama City are poor, in the indigenous comarcas, it's over 90% of people are poor. And Panama is a rich country. So they targeted the comarcas with universal services. But I also wanted to mention that it's not just India, but in every country that has a national MPI, children are poorer than adults. Every single country. So child-informed policies are vital. Then there's a need to coordinate, and this is where we show the value of an MPI and not a dashboard. First of all, we can say how many people came out of poverty. If you say one by one, how many people came out of nutrition, how many children went to school, how many people came out of electricity deprivation or water or sanitation, the journalists get bored and they walk away. But if you can tell them that 270 million people came out of poverty, you've got their interest. You hook them. And then you can say how poverty went down. But this information that I showed you on the composition is needed to coordinate because the most cost-effective policies hit multiple indicators at the same time. Like midday cooked meals that gives an incentive to kids to go to school, but also hits nutrition. So in Colombia, they looked at their MPI and they set up a roundtable with all of the ministries, and the president led it, and all of them had to attend the meetings. They couldn't send their deputies. And it focuses on monetary and multidimensional poverty. It was started by one government, and then after a change of political party, the new government continues to use it. And what they do is they look at a dashboard of all of their indicators, and the green indicators are on track to meet a target that the government set for reducing MPI. And the yellow ones are going slow, but the red ones are off track. They update their MPI every year, and they use this as a management tool. So they also map for each indicator the number of people and the ministries that are responsible. And so they are confident that their policies using an integrated MPI approach are more efficient than when they did sectoral silos. So what they found in Colombia was that these alerts could give rise to policy actions each year. So each year on the bottom are the indicators that weren't changing. And on the top, they sat together. They said, what do we do? They came up with a policy. They had some flexible money every year. They invested it together. And then little by little, each of the indicators that were lagging reduced. And as I said, it had a fantastic reduction of MPI, but it also ended with a peace deal that gave President Santos the Nobel Peace Prize. In terms of leaving no one behind, we've already discussed it in India, but every country does this analysis. And finally, reducing poverty is not just the work of government. First of all, the main actors are the poor. So in a study of moving out of poverty in India, the people who had moved out of poverty were interviewed and asked what was the most important reason you moved out. And 77% of them said, it was my own initiative. I had to put together different schemes. I had to migrate. I had to do this or that. So their agency cannot be overlooked. But nor can the business sector, nor can NGOs. And I know that some people from NGOs are on this call. So for example, in businesses in Costa Rica, they did a survey of their own employees, a census of their own employees. And they found out who was poor. And then they, as a business with all the privacy safeguards, so there's dignity, supported those households to leave poverty. So that helped the national government reduce poverty, but it helped the business show love, tenderness, solidarity to their own employees, increasing staff morale and staff retention. We spun out the first social enterprise of the University of Oxford in order to work with these businesses. So I'm coming to an end, but I wanted to point out that Sir Tony Atkinson, a beloved advisor to my research center, wrote his last book that was published posthumously on poverty. And he said that the reason we measure poverty is not academic. It's because we hope that these statistics will motivate people like you, to tackle a key challenge. So my hope is that as we all try to understand measures of poverty, we can be motivated and we can learn from each other. I have a lot to learn about how to use these measures to continue the strong trajectory of poverty reduction in India, but to get to zero, to continue work on the 377 million that were poor before in 2015, but also before the pandemic. And the only slide I would want to end on is one about censuses, that governments are also putting MPI into their census. And when they do that, they can go beyond the district level down to the Panchayat Raj, down to the Panchayat level. So in Colombia, they have their MPI in their census. Most Latin American countries do. And within 2 weeks of the pandemic, they merged their census and their health records data. And they made, these are blocks, city blocks in the city of Bogota. They have it for their entire country. Very, very, very high level maps of poverty and of COVID. So if some, maybe not all, you can't put nutrition in a survey, in a census, but if many of the MPI questions could be in a census for India, then that kind of really local data on poverty could come at least once a decade. So that's really what I would like to stop with, to say that there are still challenges going forward, but that the progress has been tremendous. So we want to look back and learn from it and then move forward. And finally, also to say that all of what I have shared is online, and I will share this presentation, and these have hot links. So if you're a data person, you can click on the Excel. If you want the do files, you can click and you can compute the MPI from bottom to top using the same files my team does. So we believe in open, transparent everything. But most of all, I want to say thank you for this interchange, and I look forward to an ongoing collaboration and working together on this important topic. So thank you for what you do.